Hello, my name is Nicole Tolbert, and I am applying for admission to the graduate program at JSU State University. First of all, I'd just like to give some background information. I completed my associate degree of nursing and my bachelor's degree of nursing from Stanford University. Then I went to work and worked in the critical care area for about 15 years, and then I decided to go into the teaching realm and have taught nursing, and now I'm currently teaching a high school health science class in Piedmont, Alabama. And then during all this time, I went back to Jacksonville State and finished my master's in 2014. And so now, looking on to further and get my doctorate degree, I would like to continue in the education field of nursing and continue to teach nursing students and help prepare the nurses for the future. There's a extreme nursing shortage right now, and we need very good nurses. We need faculty to teach these students that are upcoming and to make sure that they are knowledgeable in what they're doing and not just trying to get out there to get a job. They do understand what nursing is about. And I kind of base my nursing on a couple of theorists. One of those is Jean Watson. She always believed that nursing is about caring and that you had to be holistic. We have to treat our patients, their family members, and even students in my situation currently, that they are a whole person. We have to treat them spiritually. We have to treat them physically, emotionally, because everything has to work together in one sequence, or nothing there'll always be illness, there'll be depression. So we have to hit on everything and make sure that we touch all those needs. The other theorist that I kind of relate to is Florence Nightingale. She was the mother of nursing, but she believed we also had to care for our patients. We had to be knowledgeable. We had to continue our education, and that we had to also treat patients holistically. So, in a sense, this is what I'm trying to do, is to continue my education to where I can teach nurses, the upcoming nurses, in a collegiate setting, where we can come to that common goal and know that their nurses are ready and they are being trained properly to go into one of the greatest fields, which is nursing or medicine in general. I have been charge nurse in critical care units throughout my career. I actually came out of nursing school and with my associate degree and started working while I was working on my bachelor's. And actually within about 6 months of working was given the charge nurse role in a critical care unit. At first I thought, they've lost their mind. I don't know what I'm doing and all this, but it helped me to grow as a individual, as a nurse, to be responsible and to take that leadership role. From that point on, I've done many charge nurse positions at when I worked in Georgia teaching at Georgia Northwestern Technical College. There, I taught, was a leader, helped the assistant dean do the budgets, do the curriculums, get the clinicals together, and took that leadership role when we were lacking in that area at that time. So I kind of stepped up and did that. And then I got the opportunity to come to Piedmont and start the health science program at the high school level, and I decided to do that. And what you can see in the background, we have the mannequins. We actually have a sim man. So I can get it over here in the a lot. SIMAN, we have backboards. We have currently started an EMR class where the local rescue squad is coming out and doing the class for the students to get their certification. We do CNA certification here at the high school. So we have a lot of the modern equipment needed to do these classes. And we have started a simulated workplace area where this is teaching the students not only to be good students, it's also teaching them to be responsible adults. They have to clock in and out of class. They have to do their work, and this is part of their daily grade. And if they don't do it, then they get points counted off, just like if they were in a job. If they didn't call in sick, then they would get fired. So it's kind of like in those same things, trying to get them to teach them to be responsible. So that has been one of the things that I have started while I've been at Piedmont, along with the CNA program, getting everything set up, for the whole health science program. We offer CNA. We have some that have went and looked into doing veterinarian, to physical therapy, even pharmacy, and even being a physician. So we have them from all rounds, and they do get a start here and kind of get medical terminology and get introduced to some of the medical issues. My professional goals, like I have said, are just kind of to get to the point where I can go back into the secondary education to teach the upcoming nurses. That is my my passion. I've always liked education. My family was always in education. And so this is just something that I have enjoyed doing. I enjoy seeing the students and the light bulb come on, and they're in class, but then they go to clinical, and that's kind of when it all clicks, is in clinical, doing the clinical settings, doing the simulation labs, and they put everything together. So I take this as a challenge to do what I feel like I need to do to further my career, to help students, to help patients, and for everybody to just come out and with a positive outcome, positive attitude, and just to be the best that they can during this time. Healthcare changes every day. Technology is always changing. So there's always something new to learn, new to invest in, and this is just something that we need to do. I appreciate your consideration for the doctorate, postmaster's doctorate program at Jacksonville State University. I know this is an exciting time, starting a new program and a doctorate program as well as a nurse practitioner program. Again, my name is Sonia Nicole Tolbert, and I am applying for the postmaster at Doctor of Nursing Practice. Thank you.